welcome. I'm Catherine Banwell, your host for today's program. Today, we're going to focus on how patients can aim to live and thrive with advanced prostate cancer. We're going to discuss treatment goals and the role patients can play in making key decisions. Before we get into the discussion, please remember that this program is not a substitute for seeking medical advice. Please refer to your healthcare team about what might be best for you. Well, let's meet our guest today. Joining me is Dr. Rana McKay. Dr. McKay, welcome. Would you please introduce yourself?
Of course. Thank you so much for having me. My name is Rana McKay, and I'm a GU medical oncologist at the University of California, San Diego.
Excellent. Thanks so much for taking time out of your schedule to join us. Since this webinar is part of Penn's Thrive series, I'd like to ask you from your perspective, what do you think it means to thrive with advanced prostate cancer?
That's a very good question. And I think that's what a lot of patients want to actually, do in their day-to-day existence. I think it means that they are combating their disease. They're taking a proactive role in, tackling their illness. They are attentive to sort of doing the activities of daily living that really bring them joy and satisfaction and happiness, and setting up a treatment plan that is a mutually agreed upon treatment plan with their clinician that they have buy-in on, their caregivers have buy-in on, that allows them to do the things that they love to do while keeping their cancer at bay.
Yeah. Thank you for sharing your insights. Before we move on to treatment, I mentioned that this webinar is focusing on advanced prostate cancer. What does it mean for prostate cancer to be considered advanced?
So generally what that means is the cancer may have spread outside of the prostate to other parts of the body, such as the bone or the lymph nodes, which is a common location where prostate cancer can go. Additionally, it may mean that the cancer may have come back after it was initially treated with an intent to cure a patient, but then, the PSA demonstrates that there's a rise in PSA, and then the cancer is recurrent.
As you mentioned, appropriate treatment is part of thriving. We're going to talk about treatment approaches, but first, how would you define treatment goals?
So, when I look at defining treatment goals, it's focusing on what do we want to achieve from the standpoint of the cancer, meaning, what are objectives that are associated with patients living longer, and then what are objectives and strategies that we can set up to make sure that patients are living better. So I think the treatments are basically set up to help achieve those two goals. How can we make you live longer and feel better?
Yeah. Well, let's walk through the types of treatments that are used today to treat advanced prostate cancer. What are the treatment classes and who are they appropriate for? Let's start with surgery, for instance.
So surgery is something that's utilized early on when people are diagnosed with cancer. It tends to be utilized when the cancer has not necessarily spread to other parts of the body, but is still localized within the prostate itself, or maybe there's just some, little bit of breakthrough of the capsule. Sometimes it can be used in people that have involvement of the prostate cancer in the lymph nodes, but it's generally not utilized in people who have cancer that's spread to other parts of the body.
Mm-hmm. What about other treatment classes? What are they?
So radiation can also be utilized. Radiation is a treatment modality that can be used for people with localized disease, and also it can be utilized for people with advanced disease to treat the primary tumor. Additionally, radiation therapy can be used to help treat symptoms. If there's a bony lesion causing pain or other areas that are causing discomfort, sometimes radiation to those areas can mitigate pain. When I think about the treatment classes for prostate cancer, they generally break down into several categories. The first most predominant category is the hormonal therapy category. Hormonal therapies are really the backbone of treatment for men with prostate cancer, and they include the more traditional hormonal therapies that really work to just drop testosterone, such as LHRH agonist and antagonist, and also they include newer hormonal therapies in the form of pills that really target strategies at also affecting testosterone production and testosterone function. Another class is also the chemotherapy agents. There are two FDA-approved chemotherapies for prostate cancer that are life-prolonging, and there's a certain role for chemotherapy for people with advanced disease. There's also immunotherapy that can be utilized. There's a vaccine therapy that is actually one of the first FDA-approved vaccines for any solid tumor that's approved in prostate cancer that can be utilized. There's also radiopharmaceuticals. So these are specific agents that deliver bits of radiation to specific areas, whether it be radium-223, which targets the bone, or the newest radiopharmaceutical, which was approved called lutetium PSMA, that basically delivers beta radiation to sites of PSMA expressing cancer cells. And the last category that I would highlight is the category of targeted therapy. There are two targeted therapies for prostate cancer for patients that have genomic alterations. Those include the drugs olaparib and rucaparib. And so as you can see, there's a wide spectrum of drugs that can be utilized to really keep this disease at bay.
Dr. McKay, for these treatment classes, what can patients expect as far as side effects?
Absolutely. So I think discussing side effects is really an important part of the discussion for selecting any one given therapy. And in general, I think when we talk about the hormonal therapies, some of the symptoms that people can get is largely fatigue, but a lot of the symptoms are related to low testosterone. And so that may mean muscle loss, bone loss, hot flashes, fatigue, decreased libido. Those are things to consider with the hormonal therapies. With the chemotherapies, I think the big ones we worry about are fatigue, risk of infection, blood counts dropping a little bit, people getting tired, numbness and tingling in the hands and feet can occur, some swelling in the legs are common side effects with the chemotherapy agents. With regards to the immunotherapy with the vaccine therapy, it actually tends to be a fairly well-tolerated treatment. Maybe some fatigue, rarely some dizziness or lip sensitivity, numbness with the process of kind of like collecting the cells, but actually tends to be fairly well-tolerated. The targeted therapies can cause fatigue, they can cause the blood counts to drop and it can impact bone marrow function. There can be sometimes some GI side effects, nausea, rash. And then the immunotherapy, the pembrolizumab that is FDA approved, sometimes that can cause immune-related adverse events, which is kind of overactivation of the immune system, developing, what I call it is the itises, colitis or pneumonitis, which is inflammation of various organs and then symptoms related to wherever that may be.
When should a patient consider a clinical trial as a treatment option?
So I generally think that a patient should consider a clinical trial at almost every juncture that a clinical decision is being made. I think sometimes there's this misperception that, clinical trials should only be utilized when I don't have any other options, where in fact, I would say clinical trials should be an option to discuss every single time a treatment is being changed. Because, ultimately the goal is to make sure patients are, as I said, living longer and living better and, making sure that clinical trials are an option on the table at every juncture is really a key step in that process.
What are the benefits of being part of a clinical trial?
So I think there's a lot of benefits. I think, for patients with advanced disease, it may provide access to drugs that they otherwise would not necessarily have access to. So the standard of care therapies, we can prescribe those at any juncture. They're standard of care, but clinical trials really offer an opportunity to experiment with another agent and doesn't necessarily take away from the standard of care options. I think the other thing is, I think a lot of patients with advanced prostate cancer, they want to give back to the community. They want to leave a legacy. They want to contribute to the science. They want to be a part of that mission to make tomorrow better than today for men with prostate cancer. And I think participating in clinical trials can really help achieve that goal and also benefit the individual as well.
What about emerging treatments? Are there any that patients should know about?
Absolutely. So there's a lot of treatments that I think are currently undergoing extensive testing. There's additional targeted therapies. For example, CDK4/6 inhibitors are being tested broadly in the hormone resistant space and the newly diagnosed setting. There's also AKT inhibitors. There are other targeted therapies that are being tested. There's novel hormonal treatments that target resistant pathways like the androgen receptor degraders. There's a slew of immunotherapy options, cell therapy, bispecific antibodies that are also being tested. So there's a lot of really exciting and novel treatments that are looking at overcoming resistance for people with advanced disease.
Do you recommend that men with advanced prostate cancer get the COVID vaccines and the boosters?
Yeah, very good question. And in general, I do recommend the vaccine, especially for patients who have advanced disease and those that are on therapy. Several studies have demonstrated that patients with cancer are increased risk of having complications related to COVID, and particularly patients that are on active treatment with cancer are even greater risk. So I would definitely recommend vaccination as a preventative strategy to prevent really complications related to COVID.
Thanks, Dr. McKay. That's helpful information. Since prostate cancer affects men differently, let's review what factors could impact which treatment is right for their individual disease. How about we start with symptoms?
So yeah, I mean, absolutely. I think symptoms are definitely something that plays into effect. Sometimes when patients are first diagnosed, they may not necessarily have symptoms, but bony pain, symptoms of urinary obstruction, there's specific treatments and strategies that we can deploy to help with those kinds of things. Other factors that I think that we take into account when we're making decisions about which agent should any one patient receive is where are their sites of metastases? Is their disease just in the bones and the lymph nodes, or are other organs involved? What's the genomic makeup of the tumor? There are certain treatments that we would utilize if somebody had a certain specific genetic makeup for their tumor. I think other things that are really important are what kind of drugs has the patient seen before? Has that tumor been exposed to? Because that also helps us strategize for what to give them in the future.
Do you take into consideration the patient's comorbidities and their age, overall health, things like that?
Absolutely. Yeah, I think we need to absolutely take that into account. And I think age is one thing, but I think actually functional status is just as important as the actual number itself, because people are very, very different regarding the things that they can do at various age limits. And so that absolutely takes into account weighing in the side effects of any given therapy and how that may interact with somebody's existing comorbidities. And it may be something that we have to work with a team of other doctors to basically make sure that there is comprehensive, well-rounded care for any one patient. For example, some therapies may increase the risk of hypertension or increase the risk of volume overload. And so if somebody has issues with that already, we may have them see a cardiologist so we can make sure that, we're kind of addressing the totality of the patient experience.
What do you mean by volume overload?
Volume overload, I mean, if they've got like too much fluid on board, maybe they've had heart failure or something like that, and we have a therapy that's going to cause them to retain fluid, and so then we would have to work with a cardiologist to make sure that they don't run into issues.
Right, that makes sense. What are the common symptoms of advanced prostate cancer?
So, I would probably say they're common symptoms. And just because somebody has these symptoms doesn't necessarily mean that they have prostate cancer, but fatigue, weight loss, urinary symptoms, trouble urinating, benign prostatic hypertrophy is one of the most common symptoms or common conditions in men. And just
What does
because
that mean?
so sort of benign enlargement of the prostate, that's a common phenomena that happens with age, and it can affect somebody's ability to urinate. But sometimes with prostate cancer, it can also impact somebody's ability to urinate, their stream, their flow. They may have rectal discomfort. They may feel tired, bony pains. Usually I tell patients, persistent progressive symptoms that are just, you know, not going away, not getting better, those need to be looked at by a physician to evaluate further.
Mhm. You mentioned genetic mutations. Should patients advocate for genetic testing if they haven't had it already?
It all depends on what kind of where they are in the process. So for most men who have advanced disease, they should undergo genetic testing of both their tumor, and it is recommended also to do hereditary testing for patients who have advanced disease. And that information may not necessarily be utilized at the exact time that the test is done, but it may be utilized down the road for treatment options at a later time point.
Mhm. Once a man is undergoing treatment for advanced prostate cancer, how are they monitored to see if it's actually working?
So a lot of ways. So one is by just visiting with the patient and making sure that their symptoms are in check, they're not developing new aches or pains that are worrisome. It's by checking their labs. In addition to their organ and bone marrow function, we would check their PSA. And PSA isn't the whole story, but it is one factor that contributes to us determining whether a treatment may or may not be working. It's also doing intermittent scanning. So, CT scans of the organs and the lymph nodes and bone scan. And now we actually also have PSMA-based imaging, which can be integrated to help assess, where the disease is and not yet being utilized to assess whether something is working because we really haven't defined the criteria there, but it can be utilized as well.
Mm. Dr. McKay, how would you define precision or personalized medicine? And how close are we getting to personalized medicine for advanced prostate cancer?
Yeah. So how I define it is basically the right treatment for the right patient at the right time. It's basically, based off of somebody's genomic profile of their tumor. And ideally that genomic profiling is done close to the time that that treatment is going to be initiated. So within 6 or 12 months of somebody starting a given therapy, we understand the genetic makeup of the tumor. The tumor has, for example, a BRCA1 alteration, and we know that olaparib is a drug that can be utilized and has demonstrated efficacy for people that have that mutation, and then we would use that agent. So it's basically trying to personalized therapy based on the genomic information of that tumor. And I think we are getting there. There are actually trials now that are being launched that are biomarker driven trials with biomarker selected therapies for patients based on off of, it's not just DNA, but even also RNA to help with allocating a given therapy.
Mm. What do you feel are the common obstacles to care for men with advanced prostate cancer?
So I think that there can be a lot of obstacles with regards to um, you know comprehensiveness of the care. It's one thing to just sort of, okay, this is the next therapy to treat you with, but there's a lot of side effects that can happen with any one given therapy, and ensuring that there is open dialogue between a man and his clinician and caregivers. I think that can sometimes be a hurdle. Like that open communication is so important. It's not just about picking the next best drug, but it's ensuring that there's sort of comprehensiveness in care. And I think a lot of patients, they may not necessarily know, and they're really kind of dependent on their clinician to sort of go through the compendia of options that may be available and why one may be better than another for any one given scenario. So I think it's like that shared decision making, that open dialogue. I think also thinking about advocacy networks, I think I can say things till I'm blue in the face, like this is sort of what being on ADT feels like. But I think actually sometimes connecting with another patient who's gone through the same experience, who can kind of weigh in from the patient perspective, like what it actually feels like, I think is not to say a hurdle, but I think we can do a better job as a medical community of making those networking connections available for patients so that they can be a part of a broader community of individuals like them going through the same thing they're going through.
Yeah, it helps to know that there are others going through exactly what you're going
Yeah.
through or similar symptoms. We received a patient question prior to the program. What is the difference between my PSA level and Gleason score?
Yeah, so very good question. So Gleason score is something that is determined based off of a pathologic assessment. So it's basically, a biopsy is done from the prostate, or the surgical specimen from the removal of the prostate is looked at under the microscope, and a Gleason score is determined based off of what something looks like underneath a microscope. And ideally, a Gleason score is given really only for for tissue derived from the prostate. So if somebody has like a bone biopsy, for example, or a lymph node biopsy, they're not going to necessarily get a Gleason score per se. It's been validated from the prostate itself, and ideally also untreated prostate. So if somebody has had radiation therapy and then has a prostate biopsy, the Gleason score there should not necessarily be a notation of what a Gleason score is. It's really on untreated prostate. Now, PSA is prostate specific antigen, and it's a protein that's made from the prostate gland, and it's found in circulation. PSA doesn't hurt anybody. It doesn't, the actual molecule itself is innocuous. It doesn't hurt anything. It's just a marker of sometimes can be a marker of burden of disease in prostate cancer. And I think sometimes we as clinicians do, a disservice to some patients, because I think we can fixate a lot on PSA, but PSA is not the whole story. And it's one factor of several factors that we take into account into determining whether somebody needs treatment or whether a treatment is working or not working.
Why should patients feel confident using their voice and partner in their care? Do you have any advice?
I mean, it's absolutely important for patients to share their perspective and for there to be shared decision making at every single juncture along the way, even around decisions to not treat. So I think it's a lot of there's a lot of gray in prostate cancer and a lot of art in deciding what treatment to do at what specific time. And for any given patient, given the values that patient brings to the table, they may come to a different decision compared to another patient. So without the patient, voicing what their values are, it's impossible to make a treatment decision. So it is so critically important to have that open communication with your clinician.
Well, in addition to that, in conjunction with that, should men diagnosed with advanced prostate cancer consider a second opinion or consulting with a specialist?
I think it's always a great idea to get a second opinion. I think that, it will only empower individuals when they seek sort of a second opinion to either confirm what their physician has already told them, and then they have reassurance that they're on the right path, or maybe provide some new novel insights that they can take into consideration and just think of how that could be applied to them. So, I think that a second opinion is always really valuable. I will balance that by saying, sometimes it can be detrimental if there's lots of opinions, because I will say that coming to a consensus when there's lots of different specialists that are involved and everybody makes the soup a little bit differently.
Yeah.
Sometimes I think that can actually hurt patients and actually being able to come to a decision, because then they're like, oh, I don't know what decision to make. This person said do this person said do that, this person said do that. Right. And so that can sometimes be detrimental. But I think a second opinion, I always encourage it, always value it, but I always want the patient to bring it back to me so I can share with them and discuss, okay, I understand this is why X said XYZ, or that's the lines, this doesn't. So they need a quarterback. Like, it's one thing to sort of get second opinions, but I think every man with prostate cancer should have a quarterback that's driving their care and advocating for them.
Yeah. How can patients find specialists near them?
So I will say that they are national comprehensive cancer institutes. They're all across the country, and rural areas are not. I think finding the closest NCI designated comprehensive cancer center close to you is probably a good place to start, and identifying who is seeing patients with genitourinary malignancies or prostate cancer at that facility is a good place. I think the Prostate Cancer Foundation is an excellent advocacy group for patients with prostate cancer. They have a tremendous amount of resources to help connect patients with clinicians and other resources in their journey with cancer.
How can caregivers best support their loved ones?
So I think being present is one of the first things. I think that um, being supportive, being present, like attending the doctor's visits doesn't necessarily have to be every single doctor visit, but those critical doctor visits where clinical decisions are being made. I think it's really important also to there may be some hesitancy on part of patients, maybe sometimes to be open or vocal with their clinicians about various aspects that they may be experiencing at home, or they may be undermining, or sort of. So I think caregivers can really help in just sort of giving an outsider's like perspective of, well, actually, this is how things are going at home, and this is really how things are, and actually these are the things that we value, and we're going to go on this family trip here, and this is a big ticket item for us. Like, how can we work around planning a treatment plan that allows us to do that? So I think it's really important.
Yeah. ASCO was held in June. Is there news from the conference that patients should know about?
Yeah, so I think some of the biggest therapies in prostate cancer, that was one of the newest therapies that was just FDA approved, is lutetium PSMA. It's a radioligand therapy that targets specifically PSMA expressing cells. It delivers a little bit of beta radiation to those cells. That therapy was approved this past spring, and there were highlights at ASCO around sort of the utility of this therapy. And again, there's a series of novel compounds that are being tested in prostate cancer, not yet ready for prime time, but I think a lot of exciting work that's being done, trying to get new drugs that work better for our patients.
Going back to ASCO and new developments, how can patients stay informed about research developments like these that happen at ASCO?
So very, very good. So I think that there's a lot of networks for people with prostate cancer. I think one, again, I mentioned the Prostate Cancer Foundation. It's a wonderful community that really focuses on making sure that up-to-date, evidence-based data is distributed to patients in a manner that is that makes sense, that there's not a lot of medical jargon. And so I think that the PCF is really a wonderful advocacy resource. ASCO itself also has patient interfacing materials through their website. American Cancer Society does as well. The American Cancer Society can also be a wonderful resource for patients that are newly diagnosed or going through treatment.
Mm-hmm. Before we end the program, Dr. McKay, I want to ask, are you hopeful that men can thrive with advanced prostate cancer?
Oh, I am absolutely hopeful that they can thrive. I mean, that is, the name of the game, and I think there's a lot of people that we can look for motivation to basically show that despite treatment, despite having advanced disease, patients can thrive and continue doing all the things that they love that give them joy and satisfaction in their lives.
It seems like there's a lot of progress and hope in the field, which is good. Dr. McKay, thank you so much for taking the time to join us today.
Of course, my pleasure.
And thank you to all of our partners. To learn more about prostate cancer and to access tools to help you become a proactive patient, visit powerfulpatients.org. I'm Catherine Banwell. Thanks so much for joining us today.